Open our hearts, free every soul. The fear inside, you must let it go. Oh, that monster, before it conquers you. Yeah, we all have demons, we fight every day. You get knocked down, but the bell hasn't rang, so keep going. Just stay focused when life seems hopeless. Before life passes you by, you must try. Like a bird with broken wings always. You've gotta reach for the stars. It might seem far. Ooh, don't stop. You gotta try. Oh, 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 you gotta try. Never stop dreaming, even awake. Nothing can stop you from winning this race, so keep going. Just stay focused. Yeah, I am the tiger, I am the pride. Every storm is with the rainbow in the sky. You are golden. If no one else notices, don't stop, keep going. Before life passes you by, you must try. Like a bird with broken wings always. You gotta reach for the stars. It might seem far. Ooh, don't stop. You gotta try. Oh, 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 you gotta try. Keep on trying every day. You gotta try. All you got to do is try. You gotta try. Oh, 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 you gotta try. You gotta try. All you got to do is try. You gotta try.
I think the biggest piece of advice I have for someone going through addiction or thinking about going to rehab is being honest with yourself. Don't be afraid to get help. I think that's the biggest stigma that we're trying to erase is don't be afraid to ask for help.
Hello and welcome back to ICAN and our first of a 12-series event called Mindful Community, Raising Mental Health Awareness in Jefferson County. I'm Chris Crump.
And I'm Christopher Olson. It's great to be back, Chris. Today we're focusing on something that touches all of us, mental health. Whether we're young or old, living in a rural or urban parts of Jefferson County, facing stress at work or at home, mental health matters.
In our series of videos, we'll talk with local experts, hear personal stories of resilience, and highlight local partners you can turn to in Jefferson County, because mental health is health, prevention, awareness, and community support make a real difference.
Well, let's begin by understanding what we mean by mental health and why it's so important in our community.
Christopher has had the opportunity with his career at Shorewood Behavioral Health to travel throughout Jefferson County and talk with leading experts on trends around mental health and symptoms people are struggling with.
Chris, this is really a topic that people have a real hard time talking about and struggle with. For many people, talking about various reasons, It can be because of stigma, barriers, or various other reasons. Mental health refers to how we think, feel, and behave.
Why is it particularly important in a county like Jefferson?
In communities like Jefferson County, where people face rural isolation, limited resources, stigma about seeking help, stressors like farming, job changes,
Wow.
caregiving, the pressures can add up. Awareness and access become key issues in Jefferson County.
What are some warning signs that someone might be struggling?
We have to look for changes in their behavior, first of all, Chris. It could be their sleep, it could be their appetite, it could be just their withdrawing from friends and family, from different situations that they're always interested in, they start backing away from and not doing. They have difficulty concentrating. They are persistently sad or irritable, or they increase with using the substances or talking about hopelessness. The sooner we recognize these signs, the sooner it's going to be better that we act on them to get help.
Christopher, what's one thing people can right now do to support their own mental health?
Start with small steps, all right? Connect with someone you trust. This could be either someone at your work, this could be someone within your clergy, this could be someone in your community, someone within your home. Connect with them. Stay active, okay? It's really key that we as children, we as adults are staying active in our lifestyle. So getting up out of the house, going exercising, doing things that we absolutely love. But make sure that you're taking active steps and talk about how you are also feeling. That's something I'll talk about in a little bit with my story, is how I used to bottle those feelings up, and then eventually that didn't work out anymore. But the sooner we recognize these signs, again, the sooner that we can get the help that we need.
Thank you, Christopher. That gives us a strong foundation for the rest of our program. Now we're honored to hear Christopher's story from struggle to recovery.
Thanks,
Would you
Chris.
share briefly your journey?
Yeah, absolutely. So my struggle started when I was in my teenage years. I could notice something was just not going right with my mental health, but at the same time, I also felt like maybe this is the way life was going to be. So I kind of learned to adapt my own ways just to live and to go on with my mental health the way it was in my teenage years. I wasn't doing things that I was interested in anymore. I was instead kind of just getting by every day to day in terms of my interactions with people in the hallway, passing by them at school, reducing my activities that I was once in my life enjoying. But again, I was just still too young at that point, knowing that what I was doing was not necessarily what I should be doing.
Right.
As today, I know now, looking back at it, oh wow, all these things opened up. The average person, usually depending on what research you look at, is 7 to 11 years from the onset of their symptoms until they get the help they need. And that's for the people that get the help.
Right.
And there's so many people out there that don't get the help that they do need.
Obviously, you look in Watertown and it's terrible.
Yeah, exactly. So
what was your turning point for you?
So it really happened later on in my adult years. In fact, just 10 years ago is when I started to turn my life around with my mental health. So I was living with this for quite some time with my mental health. But you know, when I was able to turn around and get the help that I needed, it really set the foundations for my recovery. Now, when I'm saying the help that I needed to get, you know, we're looking at inpatient, residential, you're looking at outpatient programming like PHP and IOP, individual therapy, community support groups, other community resources that are out there. A lot of people need to understand that in order to get a healthy rebound from either mental health or substance use, it is a full continuum of care and it is a lifelong journey. So there are things today that I'm still working on in my own recovery that I adapt and be able to move on forward with. So, but yeah, overall, looking at my journey, looking at where I turned around, again, we're looking at 10 years ago in my life right now.
Okay, and how did it affect your family? Were they going through this at the same time with you?
My family is still by my side.
That's awesome.
It is. My wife is amazing and has always stood by my side. My children are still with me as well in my life. But they did witness everything that I was going through, and it was really hard for them to be able to really intervene with what was going on in my life. They tried several times, but I wasn't willing to listen at various points in this life. So I really was taking it upon, myself just to keep going along versus actually seeking the help that was out there that's always available and stuff in our community.
Now, how do people find this help?
There's so many ways to find it. I mean, online, it's easily accessible, right? There's, like Jefferson County has so many resource books as far as finding resources that are out there. Speaking with your primary care doctor would be a great start as well, finding some resources for mental health or substance use problems. There's also various ways in getting into communities with therapists and other things like that. Shore Behavioral Health is a great start for inpatient behavioral health in Madison. So it's just a matter of picking up the phone and reaching out when you need help. But this is also where family members can be really important for contacting these places if they see a family member struggling.
And when the family members are struggling, is there help for them?
Absolutely. There's always help for them. In a lot of settings, like for example, at Shorewood Behavioral Health, we have family therapy, for example, to work with them in terms of that aftercare plan or to update them with the treatment planning. There's also Al-Anon that helps people out for people with alcohol use disorders and how to work with them. Family therapy is a big part of people's recovery as well, and there's a lot of wonderful therapists that I've been able to get to know throughout Jefferson County that can assist with trying to help these people out with what's going on at home when it comes to family therapy.
Awesome. What message would you like to share with the others in Jefferson County who might be in your shoes right now?
To reach out, to ask for help. Again, when I was struggling, my struggle started many years ago, and I didn't get help until 10 years ago. As I mentioned to you, I see average between 7 and 11 years of onset of symptoms until people get help. Mine was well over 11 years until I got help. Reach out. Recovery is a lifestyle that is really authentic and really genuine to live in terms of the way I'm able to actually have my relationships be whole and be actual, great relationships that I can rely on right now.
I'm going to ask kind of a personal question, going back a little bit. What put you in the first steps of addiction? What brought you to that?
It was really my depression.
Depression from what?
Depression just in general. I was having a hard time articulating, my life in terms of like the way I was managing my relationships, sometimes, at work or, managing a job and having a family, and just my depression because I was always seeking higher things.
Okay.
And because I was always seeking those higher things, when I wasn't reaching them, I was becoming more and more depressed.
Okay.
It's challenging living in this world that we live in today because we're very materialistic. Like we're always looking for that next step or what the neighbors have or what this person has. And we try to really develop our lifestyles based on those things. And because of that, this is what creates the anxiety and the depression that a lot of us are seeing right now. Social media has a huge impact on our youth. With all the things that they're seeing on there, they are also trying to go after those things as well. And again, when you don't reach those things, this is where depression starts coming in.
So putting it kind of roughly, everyone is trying to get that next fix, whether it's drugs or alcohol or caffeine or a better position. We're all trying to get that next fix.
Exactly.
And we have to learn how to deal.
And that's something that recovery's taught me a lot about is humbleness and humility, and just to be humble with what I have right now.
Thank you for sharing so openly. Your story gives hope and reminds us all of the power of connection. Now let's shift our focus to prevention and early intervention. What can parents, teachers, and community members in Jefferson County do to foster mental wellness among children and teens?
The first thing that can be done is creating safe spaces to talk.
Okay.
Asking those open-ended questions. For example, how are you doing? Rather than, are you okay? Give them some opportunity to respond to that question as well. Encourage coping skills. the best thing that to do is to understand what is your children's coping skills, like what really relaxes them, what helps them regulate their central nervous system when they're seeing a lot of anxiety, a lot of depression coming into their daily lives. But things like going for exercise, nature walks, a lot of times just being outside,
More
especially like
structure.
today, fall, crisp air, helps people out. Journaling, talking, especially with a trusted adult. But biggest thing to do is to normalize asking for help. This was one of my things that I struggled with, was asking for help. So as a parent in our own homes, it's really good for us to be that role model and ask for help when we need to help in certain situations.
So giving more of a structured home life helps a lot.
Yeah,
Having
absolutely.
things so that the child knows every day what's going on.
Yeah.
Because I know with my ADD brain, I need to know what's going on. Otherwise, I flip out. And I can see how kids can do that.
Exactly. And where do they learn these things from? Peers, either in school or at home. So that's the best thing for us to do is, to normalize these things within our households and to also minimize the distractions. Put down the cell phones and have family conversations.
Yeah.
Turn off the TV when dinner's on. Have that conversation at the dinner table. If you have a spouse at home, show that example at the dinner table where you're having that conversation with your significant other. How was your day? And if your day wasn't good, talk about it in front of your children so they can hear, well, how did mom and dad go through their day when it wasn't good? What did they do? The better we are as role models with our children, the better off they're going to be when it comes to handling stressful situations as they become adults too.
The sad part of our society now is most of the parents are not home when their kids get
They're
home.
not.
Because they're working, both working.
Yep.
So how can you give us an idea of what a family can do to get more support during that time?
Yeah, absolutely. In those moments when, the family's not home as much because of jobs or other commitments that they have going on, this is where you can rely on your neighbors, for example, in terms of showing up as well and helping out. If you have good neighbors, would be a great thing. There are so many community organizations that do exist out there that we're willing to help, offer some support at the home as well. It is a world where, there is a lot of demand right now in terms of work hours sometimes at certain jobs, and parents need to meet those demands in order to maintain employment. So that can be a definite thing that could be deterring in terms of time at home and stuff. But there are many resources that do exist out there.
Now, on the other end, there are kids whose parents, put it bluntly, do not care what their kids are doing. What can those kids do to reach out to get help for them without having a parent involved?
There's always trusted parents that are out there, and for children right now, those can be teachers in a lot of cases. So, just talking with a teacher that you trust, that you have a relationship at school with about what's going on at home maybe would be a great start. Again, there's also other avenues, other interventions that can happen as well in a child's life, whether it's therapy, primary care. There's various recreational groups that they get involved in as well, different peers that they can build relationships with for that additional support as well.
Like they have the Boys and the Girl Scouts. They have other places where kids can go to play games that have mentors there to help them.
Absolutely.
And for adults, what are some early actions?
Some early actions adults can take is just recognizing the burnout that they're experiencing. So when we talked about just recently that work-life balance, right? Identifying like, okay, what is too much, and when they recognize that they are burning out, they need to be able to have these conversations with their employer. Are the demands just too much in the moment? Are there other things that can be delegated from their job at work in terms of tasks that can be delegated? Obviously, we're recognizing that's a big thing, but There's also other support things out there as well, like EAPs, which stand for Employee Assistance Programs that exist within employers.
Oh, I didn't know that.
85% of employers have EAPs. So, and the first usually 3 to 6 sessions are for free. But less than 5% of the workforce actually take advantage of an EAP program.
Yes,
right
I
now.
never heard of it before. So that's interesting.
A lot of employers do have those, and there's also community workshops. There's mindfulness, peer support groups. Those peer support groups typically do exist within recovery community organizations, which there are several of those around Wisconsin, but also other community service organizations where they can offer peer support. People with lived experience is peer support. So what can you do as far as relying on that? But also just looking at some trainings within your community. I know there's a handful of trainings that are being offered every quarter that you can go to, either led by therapists or other mental health professionals on various different coping skills and strategies that can be utilized in terms of someone's lifestyle.
Okay. What about reducing stigma in rural or small town settings?
You know, the biggest thing that can be done there is sharing stories.
Right.
Just like how I shared my story just recently, it's being authentic, being real, genuine in terms of what's going on. Having those opportunities to share your story with other people opens up the door for them. It might not right there in that exact moment, but over time it will open up something in terms of what they want to do as far as asking for help or reaching out. So sharing your stories also signifies a lot in terms of mental health affects every demographic, every age. Doesn't matter your age, your gender, your ethnicity, your income levels, as far as your net worth. It's going to affect everyone in terms of what goes on, because everyone has mental health. Just not everyone has mental illness is the thing. So I guess with that being said, that's where mental wellness comes in, and that's where we want to make sure that we're doing those healthy things in our life throughout our day in terms of allowing ourselves that time to reset, or in some cases rebound after something that might have been a stressor, whether it's at work or at home. So having that safety net set up is a real key thing.
Well, I noticed we had a lot of stigma with the, now I can't think of the word for it, for overdosing. Sorry.
Narcan?
Narcan, there we
Yes.
go. We had a lot of stigma of Narcan at
yeah.
the lodge, because the first thing I heard of everybody's mouth is, well, it just gives them another reason to overdose.
Sure.
I mean, and I tried to explain to them that any one of them could overdose because of the medications they're taking at their age, because the age group at our lodge is around 65 is the youngest. So that was hard getting past that, to get that Narcan in the building. It was unbelievable, the things that they would say.
Stigma is always going to be there in our communities. It's unfortunate that it is, but it's something that we need to understand. You know, we can do our best to reduce it, but it always will be there. It's unfortunate in a lot of cases because Narcan has saved countless lives. And it's not a reason just to go out there and use. People need to understand that addiction is a disease. And because it's a disease, you know, it needs to be treated. But there's also elements that come with that in terms of the disease and the addiction that people still need to understand in terms of what that person is struggling with when they're having a hard time with their substance.
Thank you. Those are practical steps we can take. Now I'd like to highlight key local partners in Jefferson County that provide support, education, prevention, and intervention.
So first I want to talk about NAMI. It is a great organization.
Okay, what is NAMI?
National Alliance for Mental Illness.
Okay.
It really focuses on a lot of opportunities. It has so many different programs for peer support, for families, for individuals that are struggling, or individuals that just need support, or individuals that are in recovery and want to continue to be involved in a wonderful organization. So all of the programs they run are great throughout Wisconsin. And depending on what county you live in, depends on what chapter of NAMI you're going to be engaged in. For Jefferson County, they're part of the NAMI Southeast Wisconsin, which goes with Milwaukee, Waukesha, and Jefferson County. So definitely there's other counties out there as well in terms of NAMI Wisconsin and their chapters that they're involved in, but they all have offices within those chapters that you can go to and get those resources, be involved in these groups, these programs, these trainings they even do. I mean, they do so much at NAMI, it's great.
Okay, my question is for those people that are out on the streets, that have no money, have no where to go. Is there money involved with going to these trainings, to these interventions through NAMI?
Through NAMI? No, it's free. It's part of the community. That's the beautiful thing that NAMI is they offer these services for free to the community. So essentially, they are really focusing on, you know, working with community partners, you know, to help support their work through contributions as well, so that they can give these services for free.
Cool, okay. Now second, Jefferson County Human Services, the county agency you call for crisis intervention and mental health services. Tell me a little bit about that.
Yeah, they're there 24/7. Wonderful workers at Jefferson County Human Services. They have so many people there that show up every day to help out the county and the needs in terms of what's available for the citizens. So what they're looking at doing at the crisis center is being able to show up in the community when someone is in crisis and needs stabilization. So this could be at Watertown Emergency Room, Watertown Medical Regional Center, or this could be, you know, within Fort Memorial as well in their hospital. But they could also be working with the police departments, going out to people's homes and stuff. So Kim Prop does a great job with their team at Jefferson County in terms of what they do for the county crisis work, and we like to partner with them in terms of helping them out with that stabilization piece once they reach that person.
Another one I'd like to talk a little bit about is the Jefferson County Drug-Free Coalition.
Yeah.
Because I work with them a lot, and I am amazed with Vanessa Leaders, the lady that runs it, what she does. Are there services involved with the County Human Services, or is that separate?
Well, the Jefferson County, Drug-Free Coalition is part of it in a way,
Okay.
And there are other things that the Human Services Department is going to be able to offer. You know, there's like the Aging Disability Resource Center that's in there as well. They have other departments that help people out depending on their age and needs. So it's just really reaching out to them and explaining to them what's going on, and they'll be able to offer you some services and programs for sure.
Okay, and the third thing, the recently opened Youth Crisis Stabilization Facility in Jefferson County. Oh, that's you, I'm
That's
sorry.
the MAT Center, yeah,
Yes.
that's in Watertown.
Tell me about
That is
that.
a wonderful facility that opened up with 8 beds for adolescents. Again, it's an opportunity for adolescents that are struggling with an acute psychosis episode to go there for stabilization purposes. So it allows the county to really service those teens, those adolescents that need the help, and keep them local, essentially. Okay. So it is run by Jefferson County, but the Jefferson County Crisis Services does oversee that overall, and it's a really good organization as far as programming.
Now, do they go in-house there, or do they?
Oh, it's on site. Yeah, they have they have rooms there that they'll be staying. The children will be adolescents, and they have great providers there that offer support 24/7. They do their group therapies during the day, individual work as well. So it's wonderful in terms of
Must be pretty new, because I haven't heard about it at all.
It's relatively new. It's part of Wisconsin's initiative they did. It was quite a few years ago, actually, where they opened up 5 stabilization centers throughout the state, and the MAT Center is one of them.
Nice. And lastly, don't forget our local clinics and community centers listed in the Jefferson County Community Resource Guide, such as counseling clinics in Watertown and Jefferson. We encourage viewers to take note of these resources, write down contact information, and share with someone you trust.
want to focus on really mental health right now
Okay.
again, and just understanding, you know, to everyone watching this right now and listening to us, this is not something to face alone, okay, when it comes to your mental illness and what's going on in your body. So when you see these symptoms starting to really kind of like come to a certain level where you can't manage them with your coping skills, this is where reaching out for help is necessary in a lot of places, and reaching out to a trusted adult if you're an adolescent, or a trusted member of the community, your family, for sure, and just don't wait. In Jefferson County, you know, we have so many partners and so many tools that have been built up over the years to help support the community that needs it. So it's just a matter of reaching out for the help when you see it.
Okay. Well, I want to talk about, here's some ways to take action. Reach out to a friend, a neighbor, a coworker, ask how they're doing. Attend a local workshop or support group in Jefferson County. Keep the conversation going in your workplace, your church, your school. And if you have someone you know who is in crisis, call or text 988, the nationwide suicide and crisis lifeline. Share today's program or resource list with someone else. Is there anything else you'd like to discuss before we close out here?
You know, I just want to say how humbled I am to be able to do the work that I get to do in the communities that I'm able to serve, and the conversations like with you, Chris, that I get to have with just great people that genuinely care about this topic when it comes to mental health and substance use disorders that we deal with and I see in our community. So, you know, being where I am today on my journey, and everyone I'm able to talk to, and, you know, being able to join Shoreward Behavioral Health, this excellent organization, a part of Acadia Healthcare, that really offers the communities that we serve a stabilization area for both inpatient and now outpatient services, has really opened my eyes to know that we're not alone. And once you take that step and get the help that's needed, your journey has just begun. And I do mean that because, you know, in recovery, I'm able to live a different lifestyle. I'm able to really articulate when I need help. And every day just brings new excitement, new adventures, and I get to do all these things with a mind that's at peace. A body that gets to remain sober in a lot of cases and stuff. So because of that, you know, I'm just grateful for all the work that we get to do in the community, and just the conversations I get to have.
The hardest thing I have, because I've never done drugs, I don't do alcohol, but I come from an alcoholic family. And what I see out there is how much alcohol is such a basis of our community worldwide.
Yeah.
Everything you do, everything you see has alcohol involved.
Absolutely.
So with the Elks and along with the Jefferson County Drug Free Coalition, we're working on getting more sober events out there. Like right now we have sober bowling.
Yep.
We're going to be working on like a sober bingo event, and hopefully monthly events that'll change up, a sober craft night, a sober game night. But we're working on that because to me that's important.
And I just want to add to that, to the viewers that are watching this right now, please come to these events.
Yes.
That's what makes a difference in a lot of what we do in the community is when we do these trainings, when we do these events or these workshops, come to them, please. They are free, and they're just a thing to show the community the support behind the actions that are being done when it comes to recovery.
And for you out there, it gives you a notice that you're not alone.
Exactly.
We did a 3-part series 2 years ago called Knowledge is Power. And unfortunately, 3 to 4 people attended each event.
Yeah.
And it was sad because there were so many good speakers, so much good information. But you parents need to come to these types of things, especially.
Exactly.
Well,
I just want to say thanks to everyone for joining us today on this Mindful Community segment that we're doing. Again, the overall goal of this is for Chris and I to be interviewing over the next 11 series various professionals in the Jefferson County communities when it comes to mental health, when it comes to our physical health, for substance use. So we'll be having some other professionals coming on for the next 11 series. We're excited about the lineup that we have. So we do ask for you to join us for all of the series and stuff, and definitely to reach out if you need help to your trusted people in your lives, or to trusted professionals or organizations like Shore Behavioral Health. So we're here to serve the community, and we're excited for having you being part of this show as well.
And don't forget that we're not just on the Watertown local cable access, we're also on YouTube, so you can rewatch it, every show if you want.
Yep.
And we will share all the information from each show and other shows at the end of each show. So from both of us, goodbye, take care of yourself and each other, and remember, I can, which means you can.